From the Toronto Star, I'm Adrian Cheung, and this matters. As if getting a handle on COVID hasn't been hard enough, researchers are finding different strains of COVID, ones that are more contagious and therefore easier to spread. One of those strains, the B117, was discovered first in the UK, and now it's in a half dozen other countries, including Canada.
Researchers at Imperial College London say that even with a lockdown similar to that in England in November, the number of cases would still triple, and that this was the most serious change in the virus that we've seen.
We have two experts on This Matters to explain what this COVID mutation actually is and how worried you should be about it. We talked to Dr. Isaac Bogoch, infectious disease expert and clinical investigator at the University Health Network, on what it means for our healthcare system and the policies that are being made. That's coming up later in the podcast. But first, here's Dr. Tony Mazzulli, Microbiologist-in-Chief of the University Health Network and Mount Sinai Hospital's Microbiology Department. He's here to help us demystify the science behind the new strain of COVID. Dr. Mazzulli, thanks for your time and for joining the podcast.
Thank you. It's nice talking to you.
So let's start with the basics of the B117 mutation. What exactly is this COVID variant or mutation?
So it's a mutation that's in an area of the virus called the spike gene or the spike protein. This protein is important because it's the protein on the surface of the virus that lets it stick to your respiratory cells in the back of your nose and the back of your throat. So whenever you get a mutation in that, sometimes the mutation is such that it no longer sticks to you and therefore becomes less infectious. Sometimes that mutation makes it even a better fit and therefore it sticks even better to your respiratory cells and therefore becomes more infectious. And that's what seems to have happened to this particular B117 strain, that it is more infectious or spreads a little more easily now.
Is it common for coronaviruses to mutate in this way?
Yes, I mean, there are other common coronaviruses that have circulated long before COVID. These viruses, any virus for that matter, as it continues to multiply and replicate, will develop mutations. And some of those mutations will be in any different regions of the virus. But if they happen to happen in the spike proteins or the attachment proteins, they can change how much that virus will spread or how quickly it will move from person to person.
You just mentioned that this COVID variant is believed to be more contagious, more transmissible than the more common COVID strain. How much more contagious are we talking here?
It's hard to quantify other than, in the UK and other parts where they've identified this strain, they seem to know that secondary cases, these are people that are exposed to one person who has it, seem to be much greater than people exposed to someone who's infected with the standard or the regular strain. So it's a relative phenomenon of how many secondary cases there are when you're exposed to someone who has that mutated strain.
So in material terms, what do you think are the costs of a more transmissible virus, in that researchers and doctors such as yourself too have some concerns about this? What does that materially mean in a population if this virus spreads easier?
So I think if it spreads much easier, which apparently appears to do, one is that you get more people infected in a relatively shorter period of time, which again means more sicker patients potentially, and therefore that could overwhelm the medical system. If it's a very slow progression, as some people are getting better, some people get sick, you have sort of a capability of managing that. But in this case, if you get a whole large number of people getting sick all at once because it's spreading so quickly, that could overwhelm the medical system to manage that. I think the other big concern is, will the vaccine work? And that's always been a question. At the moment, the initial sort of B117 strain, the mutations don't seem to be in a region that will affect the vaccine. Now, that doesn't mean over time more mutations can happen and that it will make the vaccine less effective. Because remember, what a vaccine is designed to do is give a person the proteins or the virus or some part of it, so it stimulates your immune system to make antibodies against that protein or that virus. But when the virus mutates or changes, your immune system then that it made to the original virus, those antibodies are not going to neutralize the new virus because it's different. Therefore, you could still catch the new virus. And there are cases of people catching the new virus even after they've had the original COVID virus.
Right, in that almost the science is out on knowing how long some of these antibodies can last. That people, after being infected one time, there have been many cases of people being reinfected again. Does the nature of these vaccines, because as you were saying, just because it doesn't affect the vaccine's efficacy now, doesn't mean further on down the road that it might not. Is it almost like a game of cat and mouse of knowing where the virus strain is and the variance is and adapting the virus to that?
Yes. I mean, a good example or analogy would be the flu virus. I mean, we know we always get a flu shot every year. And part of the reason for that is, when the flu is currently here in North America or Europe, et cetera, in the Southern Hemisphere, it's already gone through that population. And by the time it circulates the world again to come back next year, that virus has replicated or multiplied so many times, it's going to have a number of new mutations. Therefore, the vaccine you got this year is not necessarily going to protect you next year. And so the same thing will happen most likely with the coronavirus, that as it circulates through the populations and it continues to mutate, it's going to evolve.
So there's a high likelihood that this strain or another strain of COVID will eventually become the dominant strain as it works its way through the population and needs new hosts, essentially, to infect.
That's correct, because the immune system will have to make a new response every time it sees a new variant of that virus.
Is there any evidence right now that suggests this COVID variant, the B117, that it causes a more severe illness? Is it any more lethal than currently the most common strain?
As far as I can tell, and from review of the literature, there's no evidence for that. Now, having said that, the other interesting phenomenon with this particular strain is it seems to be a little more common in younger population, so children and young adults. So they're somewhat obviously healthier. Even with the original virus, they were less likely to suffer complications, get overly sick. So the question then will become, if this virus currently is amongst the younger population, if it moves into the older population, will that change how severe or perhaps how fatal the virus could be?
There are so many headlines flying around about COVID mutations. And, knowing what you've just told us about the nature of viruses and how they're almost expected to mutate, I think that's fair to say. How worried should the general public be? And perhaps at a larger sense, what should our leaders, our public health leaders in government, what should they be prepared for?
It all depends, obviously, on where those mutations in the virus are. If they're in a critical part of it that either makes it more infectious, makes it more lethal, then clearly we should be more concerned than if they have mutations in areas of the virus which have really no significant change in overall how well it spreads or how deadly it is. So if you take, for example, right now, this B117 strain, yes, it's a concern, but we're starting to ramp up with vaccine, and as best we can tell, it's not affecting the efficacy or how well the vaccine works. So that buys us time to watch and see what's happening to this virus and prepare so that we can deal with it if it does develop a future mutation that makes the current vaccine less effective. And just like we make a flu vaccine every year, they will have to look at the potential of making a modified or slightly changed COVID vaccine. Whether that's every year or every couple of years will depend on how quickly those mutations happen. From a public health perspective, clearly, it continues to be extremely important, given how infectious this mutated strain is that we follow all the recommendations, the social distancing, the masks, the washing your hands, avoiding large gatherings, et cetera, so that we don't give the virus the opportunity to come in contact with large groups of people at once.
So from a personal standpoint, we all need to keep doing the things that we have been doing in terms of social distancing and wearing masks and hand hygiene. But you're saying from a public health perspective and from a government perspective, what they also need to be doing is a mass vaccination program and rolling that out as quickly as possible.
Yes, because the more people that have it, and even if the virus develops a new mutation, it doesn't mean it might completely negate the vaccine. It may make it a little bit less effective, but it may still have some effect, just like flu vaccine continues to have some effect, even if the virus is not a perfect match. And so it's important that we get as many people vaccinated as quickly as possible and as completely as possible in order to build a base of sort of, even if it's only partial immunity to the virus.
Dr. Mazzulli, thank you so much for your time.
Thank you.
So, what should you know about protecting yourself? And what should public health leaders and governments be doing to control it? Coming up after the break, we talk to Dr. Isaac Bogoch, infectious disease expert and clinical investigator at the University Health Network, to make sense of it. Dr. Bogoch, welcome back to the podcast. Good to talk to you.
Nice to see you again. Nice to chat.
Dr. Bogoch, we've learned some of our best practices in fighting against COVID and really viral diseases, period, right? You've talked about it for months, whether that's hand hygiene or wearing masks, good ventilation. These are all part of fighting against COVID. Does the variants of the virus change that advice at all, or do we keep doing what we've been doing?
Yeah, I love this because it basically doesn't change anything at an individual level. At an individual level, we're still going to be doing the exact same thing we've been doing since March, which is putting on a mask indoors, distancing from others, only hanging around people underneath that live under the roof that we're in, good hand hygiene. When the vaccines roll around, it's time to roll up our sleeves and get the vaccine. Like, there's no difference in how we should be conducting ourselves. Where I think we'll see maybe some changes, and where we actually have seen some changes, is at a policy level, more at a country and perhaps at a provincial level. But individually, no, it means nothing. We still have to carry on and doing exactly what we've been doing before.
So from a person-to-person basis, just do what you've been doing for the past year. This is a bigger policy question than it is on a person-to-person basis.
Well, yeah, I mean, like, operationalize this. Like, what are you going to do? Put on 2 masks instead of 1? Like, no. Are you going to wash your hands even harder now? Like, no, you're not. You're going to carrying on. Ventilation, masks, distancing, avoiding those 3 C's, the close, crowded, confined settings. And, some things I get it. Some things are under our control and some things are not under our control, right? In our free time, we can usually control who we hang out with and what we do. I appreciate that it's easy to say stay at home, but of course we know there's a lot of essential workers or there's a lot of people with precarious work that have to go to work. There might not be the safest workspaces. People might have to go to work even if they're sick because they don't have paid sick leave. So there certainly is a lot that we can do to improve safety and to drive down community transmission. But quite frankly, I don't think the messaging really changes at an individual level, especially for things that are under our control. Ventilation, masking, distancing, hand hygiene, and avoiding crowded settings, just hanging out with people that live under your roof. That's enough.
When we're talking about community transmission, Dr. Barbara Yaffe says there have been more than a dozen patients that have been identified with the COVID mutation. 3 of them aren't linked to any kind of travel history. Should this be a red flag to public health officials and to the province to do more? So if not at an individual level, should that be an alarm to people who make the big decisions?
It absolutely raises a red flag, right? If you've got cases of this variant and perhaps other variants that are circulating that were acquired without any evidence of travel history, it got here somehow and it was transmitted. And how much more of this is here? And is this starting to take off? It's a problem. It certainly is a problem. Now, I think that obviously it can take time, and it's not quite clear how much, but it certainly can take time for these things to take off. I think we also have to factor this in with, it's pretty clear now that the vaccines will work against at least the UK variant. But of course, we know vaccine rollout is slow, and it's going to take months and months and months before we'll be able to vaccinate everybody who wants a vaccine. So it's a bit of a race between vaccine programs, variants taking off, adhering to public health measures, ensuring that there's, I would say, maybe an expansion of even more significant public health measures, identifying variants coming into the country earlier rather than later before they get an opportunity to take off. So there's sort of like a lot of, I would say, competing priorities, and it's not entirely clear how we're going to fare. Is this variant going to run wild in Ontario and in Canada before we have control efforts in place? Or there certainly is a chance that we might vaccinate and distance and mask and ventilate and policy our way out of this.
That point that you mentioned about testing, is that the answer? Because much was made about how that true number. We know that there's, again, over a dozen people that have that variant. But Dr. Yaffe said, we don't actually know the real number, right? Because we're not testing enough. Is knowing that true number actually an important thing?
I think it's helpful, but I mean, at the end of the day, I think it's fair to say that, if we ask the binary question, is it here? The answer is yes, of course it's here. And if you ask the question, is it all travel related? The answer is no. There's certainly a few cases that are community transmitted, which is problematic. And then you ask the question, well, what is the burden of this here in Ontario? The answer is, it's hard to say. It's hard to say because, quite frankly, it requires a lot of specialized testing. This is the genomic testing to determine how much of this variant is here and what proportion of samples this UK variant represents, and how is that proportion of samples going to change with time, which is the other important variable. So, they are doing a pretty impressive number of genomic sequencing tests per week now. I believe it's measured in the hundreds now, which is very helpful. Watching this closely and really conducting surveillance is going to be a very important point. And I like how the surveillance is also somewhat targeted, right? It's focused on travelers, but it's also focused on others in the general community. And I think that's really helpful because, you go where the money is, which is on travelers, but it's also important to see what's happening in the general community as well. And for example, that's how some of those cases were discovered.
As a bit of an overview then, we know that the variant strain is here. We know that it's more contagious. We know that on a person-to-person basis, you should keep doing what you have been doing. But in your opinion, what is the long-term answer here? Is it ramping up the vaccination program? What is our way through this?
Yeah, I hate the term multifactorial, but it's probably multifactorial. So on the one hand, further enhancing protection of Canada by ensuring those who come into the country are not introducing virus. There's a lot of different ways you can do this. Canada has taken the step to ensure that people have a negative diagnostic test within 3 days of coming into the country, okay, and are further strengthening their quarantine efforts, meaning sounds like they're bolstering that quarantine efforts, basically ensuring that people are not skirting the quarantine efforts by applying additional resources to make sure people adhere to this, in addition to further testing and sequencing of viruses of people that have arrived in Canada. Okay, I mean, we can debate that till we're blue in the face about could you do more, should you do more, how would you do more, is this sufficient enough? But that certainly isn't ignoring the problem. That is something. In addition to that, there's better surveillance within the province and within the country to look at the variants that are here. I think that's extremely helpful. I think there needs to be some pretty significant messaging on a repeated basis, and this variant or no variant, ensuring that people have the appropriate tools in place to make smart decisions so that they continue to adhere to these public health measures. What do I mean by that? You really got to work on positive behavioral change. That's a lot more than having senior political and senior public health officials wag their fingers and say, put on a mask. This is enrolling communication experts and behavioral change experts to really help drive behavioral change. And on top of that, as you point out, I think ramping up vaccination efforts as quickly as possible will be extremely helpful. Now, of course, some of that lies in the efficiency to which the provinces deploy their vaccines. But another important part of that equation is getting access to those vaccines in the first place, so those programs can be ramped up. So I think this is a problem that needs to be attacked on multiple fronts. And by attacking this issue on multiple fronts, you're also attacking several other problems simultaneously. So there's a lot of good that can be done by taking that multifactorial approach.
So as with the rest of the pandemic, there is no silver bullet. You have to do many things all at once. And that's what makes it so hard.
I would say that's right. And sometimes you hear narratives that are perhaps a little bit oversimplified. If we only did this one thing, this would get so much better. And it's not entirely true. I mean, everything that we do might add some incremental help and incremental safety and incremental benefit. But the answer is usually a little bit more nuanced and a little more couched, and interventions might not be as strong as we'd like them to be. So yeah, I do think this sort of multi-pronged approach is the right way forward.
Dr. Bogoch, thank you for your time and helping make sense of that.
My pleasure. Have a good one.
And that is Dr. Isaac Bogoch, infectious disease expert and clinician at the University Health Network in Toronto. Thank you to both Dr. Bogoch and Dr. Mazzulli for clearing up some of the, let's call it, more alarmist headlines you might see surrounding the COVID variants. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Mutar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.